Welcome, everyone, to our next session. We are privileged to have with us Dr. Annie Menzel, who is Associate Professor of Gender and Women's Studies at the University of Wisconsin-Madison. Dr. Menzel is a political theorist and former midwife, and her work focuses on understanding how white supremacy, colonization, and gender-based oppression shape human reproductive life, health, and health care, as well as theorizations and practices of reproductive justice and freedom. Her research and teaching foreground race, gender, and reproductive politics and practices in North America, Black political thought, especially Black feminisms, feminist political theory, and queer theory, abolitionist and anti-colonial theory in Black and praxis, biopolitics and Black and feminist science, and technology studies of reproductive health and medicine. Her talk today will be based on her 2024 book from the University of California Press, Fatal Denial, Racism, and the Political Life of Black Infant Mortality. And she's also working on a second book project, Birthing Paradox, Race, Colonization, and Radicalism in U.S. Midwifery, which seeks to understand the contradictions and practices in the home birth midwifery movement since 1970. She's published in a number of academic journals, Du Bois Review, Contemporary Political Theory, Political Research Quarterly, the Boston Review, and Theory and Event. And we're looking forward so much to our presentation today. Thank you so much, Dr. Menzel. We're glad to have you with us and look forward to hearing your presentation and comments and questions and conversation following it. The floor is yours. Welcome.
Oh, thank you so very much, Dr. Williams. Thank you to everyone who is here in the audience. It would be wonderful to be in person together, but I'm really happy to be able to share some of my work with you, and also to hear about the really crucial issues that this wonderful organization, the Northeast Ohio Community Resilience Center, is really foregrounding. I want to again thank Dr. Williams for inviting me, Program Director Carrington Jones for setting everything up and troubleshooting in this session. Just thank you for the really warm welcome. I'm excited to share about my 2024 book, Fatal Denial, Racism, and the Political Life of Black Infant Mortality. And you can see that my talk shares a really similar title, but it's a little less of a mouthful. And I have to say my bio is really long, so I'm going to also work on streamlining that. But so Fatal Denial, how white innocence, what I'm calling white innocence, and drawing on James Baldwin and other thinkers, threatens Black infant life. All right, so Fatal Denial, actually I'll stay there for a moment. Fatal Denial focuses on what I call the biopolitics of racial innocence or white innocence, and how this biopolitics of racial innocence imperils Black infant survival and Black maternity and gestation and reproductive life broadly. So biopolitics means the politics, the policies, as well as the broader political structures that regulate and govern health and life processes. And in modern nation states, and here I'm drawing on the thinker Michel Foucault, and then many other people have taken up his ideas. Biopolitics always reflects a society's dominant hierarchies of human value, offering life supports for the advantage. In the US, this is property owning whites, and death dealing conditions for those targeted and marginalized. So in the US, Black communities, indigenous nations, Latina communities, Asian American communities, immigrants of color, and then these structures of oppression, of course, are always compounded by class oppression and ableism, misogyny and misogynoir, and the poisoning and disposability of life and the environment that capitalism entails. So really also intimately linked, as I'll talk about, with the theme of this conference. But I want to also note that, and I'll talk a little bit about the genesis of the project, But the book's broader coordinates were set by the birth justice framework and movement. So led by, and this next slide is just an example of, this is a birthplace lab that a number of really leading birth justice advocates have collaborated on, just showing the pervasiveness of mistreatment during childbirth. But so led by Black, Indigenous, Latina, Asian American, queer, and trans birth workers and advocates, but I really will say it's been Black and Indigenous folks and some Latina folks really in the front lines of the birth justice movement, including the Bay Area group, Black Women Birthing Justice, and also the Southern Birth Justice network that I'll so I want to just highlight those as real leaders in this space. So it's led by those that have faced the most harsh birth injustice, and it centers care specific to their own community's histories, struggles, needs, and visions, which have been passed down, reclaimed, and innovated. And birth justice is tuned to these deeper legacies like Black midwifery, that I'll talk about a little bit later, while also calling for and creating practices that center the knowledge, experiences, and holistic well-being of birthing people and the kin and communities that hold them. And birth justice arose, as many of you may well know, arose out of the movement theory and analytical framework of reproductive justice, an approach forged by Black women health organizers and named in 1994, although the struggles that it names reach back, centuries. And reproductive justice comprises the core human rights to have a child, not to have a child, to raise children in safe and healthy environments, and more recently, bodily autonomy and gender and sexual freedom. From these visionary Black feminist roots, reproductive justice as a framework and movement extends across many fronts of resistance and transformation. And so organizations and change makers forwarding justice, reproductive justice, specifically in pregnancy and birth, have further extended the framework into those realms. And it really is a framework, birth justice, that refuses the longstanding forms of what anthropologist Donna Ayin Davis terms obstetric racism and what has also been named obstetric violence, creating policies, practices, and environments of safety and connection that support the dignity and bodily autonomy of all birthing people. And so these are, like I said, the Black Women Birthing Justice and the Southern Birth Justice Network are two organizations that I look to in my research and my teaching. I'm also linked with birth justice work, an avid supporter of birth justice work in Madison, Wisconsin, where I live. And for instance, Harambe Birth Doula Services is a really important Black-led organization there. Maroon Calabash is a Milwaukee-based organization that does really incredible birth justice work as well. And so Black Women Birthing Justice offers really important definition and framework of the approach, and the Southern Birth Justice Network as well does really important, incredible work in the South. Okay, and so again, and I'm going to talk about, how did this, me, a middle-class white woman, end up writing a book about Black infant mortality. I'm going to talk about that, but I just wanted to foreground the ways that the birth justice movement has really, I've done my best to really look to it as the compass of the work that I do, the analyses that I offer, and really try to also hear feedback and really do work that's accountable to these movements. And I really welcome your feedback in the Q&A as well. And so I wanted to also, just offer that, and my acknowledgement and my gratitude to these and many other organizations that have guided my analysis. In the Q&A, I would absolutely love to hear more about birth justice and community-rooted infant and maternal health and survival work that's happening in Cleveland and beyond. I read a little bit about birthing beautiful communities and lighting the way to one. And yeah, I'd really love to hear more. Okay, so with that kind of groundwork laid, let's proceed. So before graduate school, I trained as a midwife, and I was licensed from 2003 until 2015, although I was not practicing for most of that time. In fact, 2003 or 4 was the last time that I was even present in a birth in that capacity as a midwife. But in 2012, but I remained really active within midwifery organizations, and so a bit in the Washington state, like attending meetings at the Midwifery Association of Washington State, where I did my PhD. I think, and then when I relocated to Wisconsin, joining the Wisconsin Guild of Midwives there. And quite immediately, this is a white dominant organization, some, really clear and longstanding dynamics of racism, as well as homophobia and transphobia, were quite evident within that organization. And so, and that was not just at the state level, but also followed a pattern at the national level as well. And so I was involved in first conversations and then some, more formal workshops and the like around racism in home birth midwifery organizations. And so that time, from 2009, 2010, midwives of color, Black midwives in particular, were really calling on midwifery organizations, especially at the national level, to acknowledge their racism and to transform it, not just to, apologize, but to really transform these harms. And this kind of culminated in a 2012 letter of resignation from the National Midwifery Organization, MANA, Midwives Association of North America, after decades of really egregious institutional racism. So in that letter of resignation, a group of leading Black midwives and midwives of color foregrounded the everyday violence of preventable Black infant mortality. So, and so really kind of being present at that moment and hearing the ways that white dominant midwifery organizations had been ignoring this form of everyday violence, as well as the racism, kind of overt racism within their own ranks, really was very formative for me. And at the time, I was in graduate school, and I was studying Black political thought and Black feminism as a graduate student during those years. And I really found James Baldwin's formulations of U.S. white innocence, our willful denials of the founding violences of genocide and slavery that continue to structure the U.S. polity. I found that notion of white innocence that Baldwin elaborates in his work powerfully diagnostic. It really seemed to describe the dynamics that I was witnessing among white midwives. And so reading Baldwin's notion of innocence, along with other Black thinkers, Audre Lorde's rigorous invitations to white feminists to acknowledge and renounce their own racism, Angela Davis's writings about racism in the women's liberation movement. So reading these things, during the very moment when midwives of color were calling for accountability and attention to Black infant survival, was the genesis of this project. As part of a group that formed in the wake of this resignation letter, so that you can see, you know, I've got images of Sister Outsider and The Fire Next Time, where Baldwin most famously writes about white innocence in the letter to his nephew called My Dungeon Shook. And then you can see this is a screenshot of this group that formed, a Facebook group that formed in the wake of that 2012 resignation, anti-racism and anti-oppression in midwifery. And so kind of informed by, as part of a group who was formulating a statement in support of that letter of resignation, we wrote that, quote, white midwives' failure to acknowledge this history, the histories of Black and Indigenous midwifery and their, you know, violent erasure and attacks on them by the U.S., you know, white supremacist state, that white midwives' failure to acknowledge this history while laying claim to so-called traditional knowledge from the 1970s onward is an act of violence, erasing midwives of color from the past and creating an innocent present for white dominant midwifery. And it wasn't until I was working on my book, you know, over a decade later, that I went back and kind of reread that statement and was like, oh, wow, you know, I was thinking about innocence, even, you know, without noticing that I was, or kind of, I hadn't been calling it to mind even as I started my dissertation project. And so witnessing white midwives' claims to innocence, you know, oh, we didn't mean to be racist. We didn't, you know, our training didn't, you know, direct our attention to thinking about infant mortality, et cetera. You know, oh, I'm not personally racist, and so, you know, why are you, you know, coming at me, etc. Right? So witnessing these claims to innocence was a key part, or I'm a good person. That's my favorite from white women. We love saying that. Okay, so not just about so witnessing white midwives' claims to innocence was a key part of seeding this book's framework. And again, it's not about white midwives, you know, apologizing or being guilty for what has happened. I mean, but it is about being accountable and then really having the privilege and honor of listening to Black midwives and Indigenous midwives and midwives of color to support Black students and midwives and Indigenous students and midwives, crucial care spaces, in particular thinking about Black communities where Black mothers and infants can thrive. So it's just a shame, such lost opportunities for life-giving collaboration. Okay, and then I just want to say one more thing about, you know, being a white scholar, writing about Black infant survival and the threats to it. There is a long lineage of white scholars, some of whom I talk about a little bit later, writing about Black infant mortality in a way that presumes a kind of positioning that's really problematic. So the white scholar is situates themselves as an objective and normative diagnostician who is kind of themselves the standard of health and morality oftentimes, and separate from and above their allegedly deviant or damaged, right? I'm seeing a deficit here being mentioned by Dr. Finley, by the object of analysis, which is Black infants and their mothers and their families, their midwives, in some cases, during the middle of the 20th century, early to middle 20th century. So throughout the book, I attempt to reverse this diagnostic lens. So I aim to diagnose the political mechanisms of denial and deflection within that lineage of racist white scholarship that have functioned, even though it's often saying the contrary, to endanger Black pregnant people and their infants while preserving white dominance, along with misogyny, ableism, and class oppression within healthcare and the broader polity alike. So I call this the biopolitics of racial innocence. Okay, and so how does white innocence threaten Black infant survival? In her work on US prisons, abolitionist political scientist Naomi Murakawa defines racial innocence as, quote, practiced blamelessness for the death-dealing realities of racial capitalism, maintained through willful ignorance, blame displacement, and liberal reforms. So those are the three kind of tenets of or mechanisms of racial innocence that Murakawa identifies. So Murakawa's formulation builds on, oops, I'm sorry, that should not be there yet, but Murakawa's formulation builds on Baldwin's analysis in The Fire Next Time of US whites' disavowal of the genocidal racism that has constituted us as a people in a kind of Mobius strip of deadly violence and willful denial. Right? Then the denial enables more violence. And so Baldwin writes that US whites have destroyed and are destroying hundreds of thousands of lives and do not know it and do not want to know it. It is not permissible that the authors of devastation should also be innocent. It is the innocence which constitutes the crime. Now, dovetailing with anthropologist Natalie Valdez's notion of environments of racism in her book, Weighing the Future, it is noteworthy that Baldwin himself, in that same essay, My Dungeon Shook, which is the first part of The Fire Next Time, he points out the environmental hazard that white supremacy poses for Black infants. And so he writes, this innocent country set you down in a ghetto in which, in fact, it intended that you should perish. In other words, whites intentionally created the material conditions of his nephew's birth and also James Baldwin's own, which by design, most whites also never encounter that, that geography of threat, right? Of those material conditions that actively threaten Black infant life. So as Baldwin says, I know the conditions under which you were born, for I was there. Your countrymen were not there and haven't made it yet. So their white fellow citizens have created a political, legal, moral, economic, and physical geography. Yes, exactly, Ms. Ivanka Hall, yes. That protects them from encountering and comprehending, let alone redressing the destruction from which their own material advantages derive. Okay, and so drawing on Murakawa, drawing on James Baldwin, drawing on Ruth Wilson Gilmore, and many other thinkers, Loretta Ross, one of the co-founders of the reproductive justice movement. Oh, I'm sorry. Paul Murakawa's formulation, which she's using to think about prisons, and think about it in the realm of health, and particularly reproductive health, and particularly the ways that this racial innocence threatens Black maternity, gestation, birth, and infancy. And so I define it as the institutionalized mechanisms, habits, and techniques of practiced blamelessness that have at once enabled, obscured, and perpetuated racial capitalism's fatal impacts on Black maternity, gestation, birth, and infancy. So these mechanisms of willful ignorance, displacement of blame, and liberal reformism are patterns, I argue in the book, that are perceptible across the entire span of time examined in the book, from about the mid-19th century until I think 2022, 2023 is when I submitted the final revised manuscript. And I want to talk a little bit more about our own moment since then as well at the end of the talk. All right, and so then another kind of like jargony term, so hopefully it's not too off-putting, but is white settler reproductive futurity. Okay, so, and basically the biopolitics of racial innocence, I argue, is a key component of white settler reproductive futurity. And here I'm drawing on Actually, Loretta Ross's work on this as well, even if she doesn't say it in quite the same terms. Eve Tuck and Kay Wayne Yang are also scholars that have really inspired my thinking on this. And so this is basically just the organization of space, of social, political, and economic structures, institutions, laws, and norms. And so really, I mean, again, thinking in terms of environment in a capacious way, in a broad way, it's like the material conditions on the ground, right? Who lives where, who's living next to the trash incinerator, you know, who's living on the river that, um, GE or a paint company, has dumped toxins into. So it's very literally geographical, but then it's also about, laws, it's about hospital protocols, institutions, and the way that these all come together to preserve US whites' entitlements to stolen property, because for us it's all stolen, intact family, relative health, and wealth from generation to generation. So this includes inheritance laws as well, and property laws. From generation to generation at apocalyptic cost to Black and Indigenous peoples in the United States and to communities, workers, and ultimately all life on this planet. White settler reproductive futurity is most baldly articulated in the neo-fascist imperative, which now, white supremacists are simply saying out loud, to secure a future for white children, right? So this has become more and more acceptable in public discourse to simply proclaim, that this nation is for white children. But it has also long been, and this is, definitely a very alarming shift. And it's important to recognize that white settler reproductive futurity has always been kind of the central aim of this white supremacist colonial nation. And so it's long been quietly pervasive as the system of racialized sacrifice demanded, as Métis feminist science and technology scholar Michelle or M. Murphy describes it, as rich, white, settler colonial, heteronormative reproduction, right? Because this is how this stolen property gets passed on, and also the accrual continues, right? More and more theft, more and more hoarding over the generations. So this is why the heteronormative reproduction is so important. Baby making with expensive strollers assembled in supply chain capitalist webs, fossil fuel guzzling SUVs fed through pipelines, oil turned into piles of plastic toys destined for landfills, all the many forms of white possession and enablement. Reproduction here is not just the baby, but webs of relations and distributions of violence. Which, as Murphy emphasizes, is actually ultimately fatal to all of us, even the allegedly innocent whites, ultimately. The biopolitics of racial innocence denies and invisibilizes the extraction, harm, and avoidable death on which normative white reproduction is predicated. It also misleadingly posits propertied whites as separate and exempt from these broader ecologies of harm. Because although at unjustly vast differences in timescale and intensities of violence, white settler reproductive futurity, it's not a sustainable system, right? It threatens all human and more than human beings and relations on Earth. And I just want to say that Murphy's work for me has really made clear the relations, the ways that reproductive justice and environmental justice are inseparable. So just a kind of boosting Murphy's work as someone who makes those connections really clear. They say, reproductive justice leads into environmental justice, which includes water, land, non-human relations, as well as policing, food, shelter, schools, carceral systems, war, structural unemployment, and pollution. If you cannot drink the water, there is no reproductive justice. Because they say that radical reproductive justice takes as its starting point the conditions that support collective life in the face of persistent racist, colonial, and heteropatriarchal life-negating structures. And I was also thinking about this. So I had never been to Cleveland before, and I wish that I'd been able to make personal contact with you folks at this organization, but I was there to support a friend who had some days of appointments at the Cleveland Clinic, but we were there during the height of the wildfire smoke. And I was thinking about the pregnant people and the babies breathing this smoke in, as well as elders and folks with respiratory issues. Right. And so we saw, horrors of Indigenous communities in so-called Canada, like some of their communities burned to the ground and escaping in boats, as well as, of course, disproportionate impacts on those who are already vulnerable because of existing environmental racism. And it's so clear, as we were trying to, mask outside, that we all have a common stake in transforming this death-driven system that was built on enslavement and genocide, anti-Blackness and colonialism, and brutal resource extraction. Okay, so I'm going to shift gears a little bit and go kind of back in time. So the deflections of racial innocence and imperatives of white settler reproductive futurity are discernible from the very first expressions of public concern about infant death. And those arose in the United States in around the 1840s and 1850s. So these were the decades that also saw the rise of what I call the cult of true babyhood. So this is the iconization of a typically abled white cherub in a devoted maternal embrace, which is at the heart of propertied heteronuclear domesticity. So this is like one of a jillion images that you can find from white women's journals at that time that depict, these angelic white babies. And so extending Hazel Carby's foundational Black feminist account of the antebellum cult of true womanhood, the cult of true babyhood defined white infants as adored and uniquely precious, but highly vulnerable future citizens whose lives required special protections and whose deaths occasioned profound grief. And this excluded Black infants from this vulnerable and grievable category of being. This was material as well as symbolic. So the mid-19th century sacred inviolability of the bond between the middle class, typically abled, married white mother and her baby was subtended by the legal and social violability and negation of Black maternity, and actually Black paternity as well, Black parenthood. The literal embodied lives of these white mothers and their babies, either directly, if they were slave owning families, or indirectly, just as, white citizens of an enslavist nation state, simultaneously relied upon and disavowed the theft of Black women's labors and life force. So for instance, in Incidents of the Life of a Slave Girl, Harriet Jacobs' account of her Aunt Nancy's multiple miscarriages, stillbirths, and infant losses under the tyrannical demands of tending her mistress's children names this violence clearly. Upon her aunt's death, Harriet Jacobs writes that her aunt had been slowly murdered, uses those words. The true baby is the infantine version, the infant version of what Stephanie Bray and Monica McLemore, a leading birth justice scholar and advocate, nursing professor, Dr. McLemore, call the myth of the default human that is killing Black women. The manifold colonial genocides, dispossessions, and ethnic cleansing campaigns of that era, especially brutal on infants, children, and pregnant people, also rendered indigenous infant death as necessary for white national futurity. So early calls to save infant lives, which were emerging during the mid-19th century, thus emerged within a configuration of dominant white public feelings and political economy that was actively endangering, killing, and stealing Black and Indigenous infants and children in the name of white accumulation, property, and national destiny. So both alibi and kind of embodiment of white racial innocence, the true baby is the sanctified avatar of white settler reproductive futurity. And we're seeing this wild resurgence of, true babyhood and white pronatalism now in this moment. And I'd love to talk more about that in the Q&A. So true babyhood profoundly, let me just stay there, shaped the way that infant mortality as a political problem came into dominant public view. And by the 1890s, racist statistician Frederick Hoffman proclaimed that these much higher rates of Black infant mortality that he was finding, rather than reflecting the perilous conditions for Black families in the cities that he was looking at, so relegation to poor, expensive, and extortionate housing, withholding of sanitation services, exploitative and dangerous working conditions, uncertain access to good food and clean water, criminalization, medical apartheid, and racial terror. So instead of looking at these conditions, which his critic W.E.B. Du Bois did, he kind of his diagnosis was that high rates of Black infant mortality heralded a so-called dying race. And so the scholar Khalil Gibran Muhammad, in his book, The Condemnation of Blackness, calls this the disappearance hypothesis. By the 1920s, this disappearance hypothesis no longer held sway among public health authorities. But nevertheless, these authorities remained wedded to stories blaming the neglect and allegedly harmful behaviors of Black families, especially mothers, and community members, especially midwives, whom Southern states at once scapegoated and conscripted as kind of stopgap caregivers, subject to harsh state surveillance and threats of criminalization. And I'll talk a little bit more about that in a moment. All right. But my book doesn't only track these, really violent mechanisms of the biopolitics of racial innocence. It also really uplifts and amplifies key Black political thinkers and actors' contestations and transformations of the very conditions that are threatening Black infant life. So the political thinkers and actors whose work is also at the center of this book lived, mourned, organized, and worked to transform the conditions that imperiled their own and their communities' children. In different ways, they all refused this biopolitics of racial innocence and contested the justificatory myth of true babyhood. Racist statistical studies like Hoffman's that blamed Black parents for their own infants' demises, in fact, Hoffman's account came out just when race leaders W.E.B. Du Bois and Mary Church Terrell themselves became bereaved parents in the 1890s. So this really hit home, and I have a chapter each on Du Bois and Mary Church Terrell. So among other strategies, Du Bois situated U.S. Blacks' numbers within international mortality statistics, in fact, showing that death rates were equally high for the urban poor in several European cities, to debunk Hoffman's conclusions about race decline, as well as Du Bois writes a devastating account of his own son's death in his book, The Souls of Black Folk. And this is his beautiful son there with his wife. Burkhart is his son. Along with other Black club women, Carol addressed the urban conditions that made Black mothers and infants vulnerable, establishing daycare centers, kindergartens, and homes for single women new to the cities. And it's notable. So Terrell was involved in actual like shifts of those material conditions and supports for especially poorer Black mothers. But they also contested the biopolitics of racial innocence rhetorically in their writings and speeches, along with its figurations of Black parental damage, infant moribundity, like infant kind of inherent weakness, and white beneficence, emphasizing instead the death-dealing environments and murderous bad faith of whites. Like her contemporary Ida B. Wells, Terrell highlighted the agency of white women, for her, mothers in particular, for perpetuating deadly environments of racial violence. So I'll read from one of her essays from 1904. Terrell writes, I think in really provocative ways today as we think about epigenetics and environmental, inheritance, the kind of interplay between environment and inheritance. She writes, the men who lynch Negroes today are, as a rule, the children of women who sat by their firesides happy and proud in the possession and affection of their own children, while they looked with unpitying eye and adamantine heart upon the anguish of slave mothers. In discussing the lynching of Negroes at the present time, the heredity and the environment, past and present, of the white mobs are not taken sufficiently into account. It is too much to expect, perhaps, that the children of women who for generations looked upon the hardships and the degradations of their sisters of a darker hue with few, if any, protests, should have mercy and compassion upon the children of that oppressed race now. And so I also want to call attention to how this resonates with the work of Stephanie Jones Rogers, who wrote They Were Her Property, looking at the role of white women slave owners. And Stacey Patton, the brilliant commentator, has also written kind of about white children's socialization into violent white supremacy. All right. And so, really, censuring these refusals of the biopolitics of racial innocence on the part of intellectuals and public figures like Du Bois and Terrell, as well as the work of less public but no less crucial figures and community members and caregivers, rural Southern Black midwives under Jim Crow. So situated very differently than Du Bois and Terrell in terms of geography, education, and class location, they operated under the shadow of white public health authorities' accusations of being agents of deviance and death. Midwives like Mary Coley, who's pictured here from the film All My Babies, refused the biopolitics of racial innocence primarily through their practices of community care for infants and mothers, under dire conditions of racial terror, enforced debt and poverty, and medical apartheid. Though some have also told their stories. In the present day, calls for birth justice, in which practices and environments where Black maternal, infant, and community life can thrive carry this lineage forward. And I want to just uplift that historian Wangi Muigai also writes about these midwives, as well as Black physicians, club women, and the Black press, mitigating this broader context of white supremacy. All right, and I know we started late, and so I am moving into the last part of my talk, but I also want to tell the organizers, feel free to come in and cut me off at any time. So in the balance of this talk, I query how even as new understandings of racism's harms have emerged in the present day, like over the last couple of decades in particular, the biopolitics of racial innocence persist. And I also would love to close, and maybe this can start our discussion, think about the shifts over the last 2 years. Because like I said, I finished this book, during the Biden administration. And we've certainly seen a lot of very harmful shifts, even just in the last 2 years, in both kind of rhetoric, or the ways that people talk about um, the importance of the white birth rate, for instance, and notions of race suicide among white supremacists that are just like out and proud now, as well as the really terrible impacts of funding cuts, of course, racist immigration enforcement, and many other factors that are threatening the well-being of communities of color broadly, and impacting Black communities in particular. Okay, and so I talked about the mechanisms of the biopolitics of racial ignorance. Ignorance is part of it too, but racial innocence. And so one thing that I know in my book is that there are often kind of when there's a clear site where the biopolitics of racial innocence is at work, there's often a contradiction between the description of a problem and then the prescription of the solution. And these often mark sites of willful ignorance, as the experts bring relevant conditions into view, or even acknowledge Black communities' unjust exposures to harmful conditions, but then only to default to racist conventions and stereotypes in their ultimate diagnoses and interventions. The displacement of blame, the second mechanism, from economically exploitative and white supremacist structures, as well as medical and other forms of institutional racism, onto Black women, families, and communities themselves, is a central feature, possibly the central feature of the biopolitics of racial innocence. As obstetrician and reproductive justice scholar and advocate, Karen Scott and her co-authors observe, quote, structural racism is embedded in mother blame narratives that often dominate maternity care / neglect for Black women, unquote. And then finally, liberal reformism manifests through discourses of official concern, a kind of performance of racial progress disconnected from structural transformation. So it's like a dynamic of loud lamentation paired with institutional inertia that sustains protections for white infants and harms for Black infants. So in many cases, this has entailed funding for established agencies and programs in the name of addressing Black infant mortality, even as these agencies systematically fail to address the root causes at work. Well, the grassroots maternal and infant health work in and by Black communities themselves often goes unfunded or underfunded. Doula and community organizer Hakima Tafunzi Payne, who's the founder of Kansas City's Uzazi Village, terms this parasitic dynamic disparities pimping, which she got from health advocate, breastfeeding counselor, and fellow doula Sherry White. I just think that's such a powerful term. Liberal reforms also individualize and atomize both patients and providers. And so the broader context, that broader environment, recedes from view. Okay, so I want to talk about kind of two official documents. And again, we can switch to kind of move to discussion at any point. And so in May 2007, the Office of Minority Health of the U.S. Department of Health and Social Services launched an initiative, A Healthy Baby Begins With You, designed to, quote, target the African American community to combat its disproportionately high rates of infant deaths. The campaign's brochure makes clear who this you is. I see you, Dr. Williams. Should we can move into discussion at any time if time is getting short.
Yeah, I just finish. You can finish what you were talking about, and we could, participate in some conversation if that's fine with you.
That's fine, and I'm sorry I am going over. Okay, so what I'm going to do is I'm just going to talk about this this campaign. I won't move into the later case example, and then I'll go ahead and conclude the talk.
Thanks.
So underneath this statement, you can see that a healthy baby begins with you. You can see that this little life rests in a pair of well-manicured, brown-skinned, feminine hands. So it's clear who the you is. It is Black mothers themselves. So the brochure reads, the Office of Minority Health wants you to know that infant mortality is preventable. Step up and help end infant mortality, right? And these contributing factors on the other side of the brochure makes it unmistakable that this is really the individual responsibility of Black mothers. So even though it states that an infant's survival and long-term health is influenced by many factors, they conclude by naming that, highlighting mother's age, health status, and behavior during and after pregnancy. When they name the factors that they name, all but 3, high stress, domestic violence, and preterm labor, are clearly linked to behaviors deemed irresponsible or pathological. So that's like not eating well, not exercising, smoking, etc. But the naming of stress is significant here because there was a lot of research starting in the late 90s, early 2000s about the impacts of stress. But while this research, including research by the groundbreaking anthropologist Leith Mullings, looked to the environment as the causal factor of this stress, the way that it was taken up by health authorities, in fact, rooted the stress as a kind of individual problem. All right, and I'm just going to, I'm going to conclude there. I want to just end with one really troubling slide, which is, I think, the cult of true babyhood 2.0, or I don't know, 3.0, 4.0, which is now we're seeing, white pronatalist conferences. This is one from Austin in 2025, where there are, it's a whole conference dedicated to increasing the white birth rate. Even as, these kind of long-standing and troubling threats to Black infant life were definitely still, major hazards during the Biden administration. We're now seeing we're in a different moment that compounds these threats. So I'll end there. Sorry it took so long for the late start, but I look forward to some discussion.
Dr. Menzel, thank you so much. We wish we had more time, and we'll have some time in the roundtables, which will follow, our brief Q&A, so we'll be able to continue that conversation. But it's such a rich conversation. 2 quick questions. One around, racial capitalism and the political economy of controlling Black reproductive health.
Yeah.
Your work is interesting where it connects with and relates to a number of scholars. Law professor Dorothy Roberts' Killing the Black Body, Race Reduction, the Meaning of Liberty, Shattered Bonds, of course, The Color of Child Welfare, and Fatal Invention, Science, Politics, and the Big Business of Recreating Race in the 21st Century, where he talks like what you're talking about, genetics and biotechnology and the reintroduction of biological concepts. And you mentioned Hoffman. But it also connects with the scholar we've had before, a couple years ago when we had Dr. Kamisha Russell, philosopher, I think at University of Oregon, and her work when she was presenting on the state of relationships in the African community on the assisted reproduction of race, where she talks about art and the ways in which it functions in medical technology, in vitro fertilization, artificial insemination, gestational surrogacy, and how those inform notions of what it means to be parents and or family. So, if you could first speak to the whole issue of how that compounds, as you're talking about the fatal denial in your work, of this whole complicated character of racial capitalism and the political economy of controlling Black reproductive bodies. Thank you so much.
Absolutely. Well, I do want to just note one of the thinkers that has been so influential for my work is the anthropologist Dr. Donna Ayin Davis, and she's actually also written about obstetric racism and assisted reproductive technologies, and just the ways that so she really usefully has kind of schematized the ways that obstetric racism really works, in terms of, diagnostic lapse, and that can threaten, that's one of the major causes of Black maternal mortality postpartum, is that, a mother will come in and complain. They know their body, they know something's not right. And it's, they don't get a diagnosis until it's too late. Neglect, dismissiveness, or disrespect, intentionally causing pain, coercion, ceremonies of degradation, medical abuse, and racial reconnaissance, or kind of hypervigilance. And so I think, I'm really excited to look at Dr. Russell's work. But this, the ways that these kind of protocols of racism that birthing units, and assisted reproductive technology, clinical sites share, is um, it is, linked to a profit-based and extractive medical system more broadly. So one of the things that that Dr. Davis talks about in the book, and in fact, it's the focus of the book, is the ways that NICUs, so neonatal intensive care units, are actually like a major, profit source for hospitals. And so there's actually incentive for, unnecessary, for both, harms that can endanger infants, so that it's, makes sense, so that they need care in the neonatal intensive care unit. And then they also often just get shunted into the NICUs, as this is something that's profitable for hospitals. So it's a kind of both and. So there's a kind of follow the money element. And then there is the ways that, Black women's labors and life force continues to motor the US economy in formal and informal ways. And I'll say one more thing, I think it's incredible the work that Black doulas have been doing to really create kind of some shelter from the broader environment of white supremacy, and its, real assaults on Black mothers, and pregnancy and gestation, and birth and infancy. But at the same time, these doulas are not paid well. It's often not, it's not economically sustainable work. And it's very taxing. And oftentimes these doulas are mothers themselves. And so it's again another case of, and especially as, Black doulas get held up as the solution to Black infant mortality, instead of hospitals reforming their own racist practices. It's yet again outsourcing, underpaid or sometimes even unpaid labor to Black women, and oftentimes Black mothers, in ways that, don't at all impact the bottom line of hospitals. So I think those are a few different ways, I think we might get at the question that you posed.
Thank you so much, Dr. Menzo. I wish we had more time, but we will have some time in the two roundtables that we'll talk about. And again, thank you for your scholarship and your work and presentation. It shows that good scholarship has value and resonance beyond the academy, the ebony or the ivory tower, to bridge theory and praxis. And so we're grateful to you for presenting and being a part of our conference, and for your work and how it does connect everyday people's lives with the work that goes into researching and writing significant works such as yours. So thank you so much for your presentation, and hope that you will join us in our roundtables. Just want to make a quick mention to everyone as we begin to move and transition to our roundtables. We have two roundtables that will take place. Of course, roundtable 1 and roundtable 2. Roundtable 2 will be with Dr. Menzel, and I think so you can access those via the social lounge. So we'll be around if you need any help or assistance in being able to do so, but we will move to that following ending of this session. And then after that, we will proceed as according to our schedule. Again, thank you so very much for your time and your attention and your attentiveness and your comments. And look forward to interacting with you and talking with you for the rest and remainder of our session. So thank you so much, Dr. Menzel. We'll look forward to talking with you in our roundtable.
Thank you.
Thank you.